Hello, I'm Catarina.
Hello, I'm Manuel. We both are from Portugal, and today we will be presenting a webinar that focuses on a very special and new prosthetic component, which is the OMNI abutment.
So, during this lecture, we will show you how you can use it to obtain beautiful aesthetic results on a variety of cases, from single units to full arch. And we will start with a case that shows exactly how versatile the OMNI abutment can be. This is a complex full mouth case in which we were able to use the OMNI for single crowns, anterior bridge, and also posterior bridges. So let's see the case. So this is the initial panoramic X-ray. The patient's oral health, as you can see, was very compromised in general. Several old treatments were failing and several extensive carious lesions were diagnosed. In the interoral pictures, you can further understand the extension of the problems. Also, we can note a severe collapse of the vertical dimension and completely wrong occlusal plane. The patient told us also that at this point she could not eat properly anymore because both the anterior upper bridge and the bridge on the third quadrant were moving. Here you can see the occlusal picture and also pictures without upper anterior bridge. These are the initial extraoral pictures of the patient, and as you can notice, the aesthetics was also compromised. So, after a proper diagnosis, we proposed the following treatment plan to the patient. First, on the upper, treatment of the carious lesions, extraction of the hopeless teeth and implant placement, and then a posterior bridge on the first quadrant over OMNI abutments, an anterior bridge from 12 to 22 over OMNI abutments as well, a single crown for element 26 over the OMNIs, and finally a connective tissue graft was planned as well for the first quadrant and anterior zone. As for the lower, we plan to do direct composite restorations to treat the vertical dimension collapse, extraction of hopeless teeth, placement of 3 implants on the third quadrant, and then a single crown over OMNI for element 33 and a bridge over OMNI for the posterior teeth. So in order to perform a proper pre-surgical prosthetic plan of the case, we did an initial intraoral scan, which you can appreciate here. You can see a video and also some photographs of the scan. And also a 2D simulation using a specific dental CAD program. Then the 2D simulation was translated to a 3D mockup and tested on the patient's mouth. Here we can appreciate some extraoral photographs of the patient with a pre-op mock-up. And also a close-up of the mock-up. And finally, the comparison between the initial situation and the mock-up. Both us and the patient were happy at this point with the mock-up, so we proceed to the surgical plan.
So, as Katerina said, she did the mock-up and everyone is happy about the shape and the final position of the future restoration, so we can advance to the surgical planning. To do that, we start with the original STL that Katerina showed you before, then we superimpose this STL with the mockup, where we can place virtually the implants in relation to the future position of the prosthesis. And after that, what we do, we extract virtually the teeth in order to be able to design the guide, and then, as you can see, we design the guide that is able to be printed in a 3D printer. So, for the anterior region, we plan implants on the 12 and 22. Both implants were at 3.8 by 11 millimeters, and here you can see the planned position for the implant on the 12. You can see, and then for the implant on the 22, again, as I told you before, at 3.8 by 11 millimeters implant. So this is the plan for the tooth 26. Also a guided implant was planned, and in this case we planned the 4.3 by 9 millimeters. So in the lower jaw, the process was the same, since we also plan to do guided surgery to place implants on the third quadrant. So the same as I told you before, we start with the original STL, then we virtually extract the teeth, and finally we proceed first by the placement of implants virtually, and then designing of the guide that we are able to print it and have our physical guide for the surgery. So now I can show you here the planned position for each implant. First, as you can see here, the 33, that is a 3.8 by 11 millimeters. Then I can show you here the implant on the 34, a 3.8 by 9 millimeters implant. And finally, I show you here it's the implant on the 36, a 4.3 by 7 millimeters implant. So everything is planned. We can go for the surgery, and now I'll show you what I did in the surgery. So first, what we do, we have to extract the roots. So in order to have the best outcome possible in the end, we have to be very careful with the tissues in order to not make any damage both for the soft and hard tissues. And this is the image after the extraction of the roots. So after the extraction, we place the guide, and first we have to check the fitting and the stability of the guide. To do that, normally what I do is look at the cusp of the teeth, and I have to be sure that the guide is properly seated there. So if the guide is in the correct position, we can proceed with the drilling, and what I like to do is to drill one implant at a time and then place it. This is the way that I can make sure that I achieve enough primary stability in order to be able to do immediate loading. So here you can see on the left the anterior implants on its final position, and on the right the OMNI abutments plus the respective healing caps. Also, you can check in the occlusal pictures that I did regarding to the soft tissue to obtain a better pink aesthetics. What I did was to do a connective tissue graft around both implants and the pontic sites in order to have a better volume, and after that a better pink aesthetic of our case. So this is also the front view of the end of the surgery, and after that we proceed with the immediate loading. Here you can appreciate the panoramic post-operative. As you can see, in this first surgery we placed the implants in all locations except the first quadrant. We loaded only the anterior upper implants, and we also decided to submerge the implants on the third quadrant due to factor related to the quality of the bone in this area. Here you have 1 week of follow-up of the surgery. We have a pretty decent healing. I think the tissues are looking very good. And this is 3 weeks after surgery. It's pretty decent. Good improvement of the aesthetics. And at this point you can see that the papilla between 11 and 12 and between 21 and 22 still isn't complete. But 2 months after the surgery you can see the papilla is now almost fully present, and this is because we increased the volume of the soft tissues, which gave support to the tissues to grow and fill the space that they have between the teeth. This is both lateral views 2 months after surgery, and what I did 3 months after the first surgery, we proceeded with the third surgery on the third quadrant, where we left the implant submerged. So in this picture you can see that there wasn't much volume of tissues and also no much keratinized tissues. So nowadays, as we all know, it's very well known that in order to avoid problems around implants, it is mandatory to have a good thickness of tissues in order to protect our implants and make a good sealing of the connection of the prosthetic abutment and the implant. So to achieve that thickness, we graft a connective tissue graft from the palate, and in these pictures you can see how thick the graft that you can get from the tuberosity, and this way I could cover a very extensive area with only one graft. We did a split thickness flap, we placed OMNI abutments and then the connective tissue graft around the implants, and here with the connective tissue graft suture and the healing caps in the place. Then we suture the flap and wait for the healing.
Okay, so then 1 month after this second stage surgery, this is how our tissues are looking. So we can appreciate how the graft healed very well around our OMNI abutments, and also how these narrower prosthetic components allow to preserve a greater amount of soft tissue. This is a 4-month follow-up of the upper anterior arch, and here as well we can observe a great healing of the soft tissue around our implants and OMNI abutments. It is important to mention that the 3D position of the implants, the use of proper prosthetic components, and also the soft tissue management are crucial for obtaining a beautiful aesthetic result and also to ensure the longevity of the treatment. So at this point we could proceed for our final impressions. Here you can see the scan bodies attached to the OMNIs and ready for digital impression taking. This is a frontal view of the scan bodies. And here we have an occlusal picture of the upper, where you can see all the scan bodies in place, and also some lateral pictures of both quadrants. In this case, we opted to follow a complete digital workflow, and here you can appreciate a video of the final impressions. You can see scanning the upper arch, teeth and the scan markers. Then here on the single implant of the 26, and finally the implants on the third quadrant. Scanning everything. And finally the bite. And now some videos of the scan completed on the software. You can see we have everything we need. Also a picture of the upper arch scan and video, and some pictures of the lower arch and upper arch scan as well. Also, this is a very important step for us when doing the final impressions. It is the scan of the provisional restorations. By scanning the provisionals, the lab will be able to copy the tooth shape and the gum emergence profile for the final restorations, saving time on try-ins and making sure we will not lose all the work we made during gum modulation with the provisionals. And now we jump for the laboratory workflow, where we can appreciate some steps of the CAD/CAM process. Here as well, the design completed, ready to mill. And finally, we obtained our final restorations. These are zirconia restorations produced with CAD/CAM technology. Another picture. Here you can see with more detail the upper posterior bridge and the upper single crown. Here the upper anterior bridge. And finally the lower posterior bridge and single crown of the 33. Now in this video I'm doing the try-in of the anterior bridge over the OMNI abutments. We can see how the gum looks very natural, and also how the crowns adapt very well to the soft tissues producing, in our opinion, a very beautiful and natural result. This is a close-up of the anterior bridge immediately after placement on a front view and also in lateral views. In these periapical x-rays, we can appreciate the proper fitting of the bridge to the OMNI abutments. And here we can see an occlusal view of the workflow for the posterior bridge of the first quadrant, initial situation, then the OMNIs, the exocad process, and the final situation. This is a close-up picture of the bridge and also the periapical x-ray confirming the proper adaptation of the bridge to the OMNI abutments. Then we can see the workflow of the lower restorations. So initial situation, the implant placement submerged, then the second stage with the connective tissue graft, the OMNIs and the healing of the tissues, the scan, and the final result. And here you can better understand how we went from a situation with almost no soft tissue to the final situation where very healthy soft tissue with proper volume and architecture is visible around our implants and crowns. Here, a lateral view of the final situation. We think we managed to integrate well the crowns with the patient's natural teeth, and also we can note very healthy gums and a big improvement on the bite and vertical dimension. These are periapical x-rays of the lower implants. Again, we can observe a proper fitting of our restorations. And now some before and after pictures. First, a close-up of the anterior zone. Here, a lateral view of right side. Lateral view of the left side, and here note the big difference on the bite and also on the soft tissues around the restorations of the third quadrant. Here, interoral pictures in a front view, before and after. We were very happy with these results as we managed to improve her overall oral health, cleaning all the infections and improving the mechanics of her bite, but also to improve the aesthetics of her smile. Here you can see the external pictures before and after situation. Here the final panoramic X-ray. And finally the comparison between initial and final panoramic X-ray. I think that here as well it is possible to appreciate a great change in the oral condition of the patient. Okay, so now let's proceed to the case number 2. The second case we'll present is also a full mouth case in which we did a combination of crowns over implants, crowns over teeth, some direct composite restoration, and also a complete fixed prosthesis over OMNI in the upper arch. Here we can appreciate the initial intraoral photographs of the patient, note the many gingival recessions and absence of several teeth. Unfortunately, this patient had already a story of failed bone augmentation on the second quadrant, as you can perceive by the scars on the palate. Also in these external photographs, we can see how the aesthetics were very compromised. The patient told us she was very upset with the appearance of her smile. This is the initial panoramic X-ray of the patient. We can note a significant loss of attachment in most of her teeth, but especially severe on the upper ones. During clinical examination, we detect grade 2 and 3 mobility in several upper teeth. Also, we can notice screws on the second quadrant from the previous failed bone augmentation. So, following a comprehensive diagnosis, we decided to extract all upper teeth and also the hopeless teeth on the lower arch. The remaining teeth were maintained and treated by non-surgical mechanical debridement. Then on the upper arch, we plan to place 7 implants, OMNI abutments, and a complete zirconia fixed prosthesis. Immediate loading was also planned for this case. As for the lower, we planned a short-term orthodontic treatment with invisible aligners to improve tooth position, then placement of 2 implants to replace teeth 44 and 45, and crowns over teeth on the incisors. As we do for most of our cases, we started by collecting all the data we need in order to perform a proper pre-surgical prosthetic plan of the case. So here you can see the initial intraoral scan of the patient. Also, using patient's extraoral photographs and some important measurements I took during clinical observation, I was able to obtain this 2D smile simulation where I planned the position, shape, and also dimensions of the future teeth. Then, my lab technician translated the 2D smile simulation to a 3D mock-up so I can test in the patient's mouth. In this case, because it was a subtractive case, I painted the patient's own teeth with a black pencil to better analyze the mock-up. This mock-up will later be used to plan the position of the implants, resulting in a prosthetic-driven orientation of the implant's position. Here you can see a close-up of the mock-up, and here a comparison between the initial situation and the patient with the mock-up. Both us and the patient were happy with the results, so we proceed with the surgical plan.
So, the same story as before. We first did the mock-up and everyone approved the mock-up, so we can start to plan the surgery and do the planning of the guided surgery. So we have to have the original STL of the patient. We can use it by a digital impression or a conventional impression that is later digitalized on the lab. So after that, we superimpose the preoperative STL of the patient with the mock-up, and then we superimpose that with the CBCT of the patient. But after that, we have to place the implants and guide our surgery by the mock-up of that we approved for the prosthetic. So, as we already saw, as I already guide the implants by our prostheses. Here you can see what we planned for this case. Basically, we planned this is the position of the implants we planned, and we planned basically 7 implants, and this was the planned position, as you can see in this image. After the planning is approved, we can basically design the guide, and this is the guide after the printing. It was printed in the 3D printed and is ready for the surgery.
So, as we mentioned previously, in this case we also plan to do immediate loading, and in order to do that, the lab fabricated this interim prosthesis according to the previously approved mock-up. The provisional restoration was milled from a PMMA disc.
So, we have the guide, we have the provisional restoration, we can go for the surgery. Then, on the day of the surgery, the first thing to do is extractions. And we should do it very carefully in order to preserve both the hard and soft tissue as much as possible. This is an occlusal view in which you can see the post-extraction sockets that were well preserved. Also, you can see that we left both the left molars and the right molars. I think in this image you cannot see, but we left these two in order to give more stability of the surgical guide. On the second quadrant, we open a flap to place the implants on the desired position. As you can see in the image on the left, is the guide in position with the molars still in place, and as I said before, I like to drill one implant at a time and place it to be sure that I achieve enough primary stability. This is especially important when you go for a full arch prosthesis. So this is the drilling sequence, as you can see, here for the implant on the 21, and here the implant placement. So after all implants are in position, we place the abutments, and then we attach the impression copies to do the immediate impression we will use to produce the provisional restoration.
Exactly, and after placement of the implants and OMNI abutments, so I proceed to the clinical steps to, like Manuel said, obtain the immediate provisional prosthesis. Here I was attaching the provisional to the temporary abutments. Here you can see an intraoral picture immediately after the surgery, and also the post-operative panoramic X-ray confirming the proper fitting of the prosthesis to our OMNI abutments. As you can see, the immediate prosthesis is only attached to 5 of the 7 implants we placed because the 2 most posterior implants did not achieve enough primary stability to load. Here you can see the intraoral picture 1 week after the surgery, and here the extraoral picture also 1 week after the surgery, in which we can already see an improvement on the aesthetics of her smile. This is a 2-week follow-up, everything is healing well. And then,
as Katrina was telling, 3 months after the surgery, we did the second stage surgery of the implants that will have submerged because of the lack of enough primary stability to load.
Okay, so at this point, at 3 months after their surgery, the patient was going tell us that she was going to travel to Australia for 2 months. So we decided, instead of starting the clinical steps to obtain our final restorations, as we didn't have enough time for that, to ask the lab to produce a new provisional restoration with some modifications in tooth shape and especially on the emergency profile. That way we could already start working on our gum modulations and prepare everything for the final impressions. Here you can see a 3-month follow-up already with the second provisional restoration in place, and another picture of the second provisional restoration. Also the periapical x-rays confirming the proper fit of the new provisional prosthesis to the OMNI abutments. And these are the extraoral pictures comparing initial situation of the patient and after delivering the new provisional restoration. So, when the patient finally came back from Australia, about 2 months after we delivered the second provisional restoration and 5 months after the implant surgery, we were ready to go ahead with final impressions. So I unscrewed the provisional prosthesis, analyzed clinical and with periapical x-rays all the implants and abutments, and that's when I realized that unfortunately the implants on 16 and 26 were lost. So now let's try to understand first why this happened and then what to do next.
So basically we can have 3 different types of implant failure: immediate, early and late. In this case we had an early failure as it occurred within the first month of implant placement and before placement of the final prosthesis. If you remember, we didn't even use the implants on immediate prosthesis. This type of implant failure is clearly described in the literature as being solely a biological complication. In this specific case, we could identify the following risk factors. So,
posterior maxilla,
D4 bone, history of periodontal problems, several systemic conditions, and polymedication.
Yes. So now that we understood why it happened, we need to know how to solve it. In this case, we could follow 2 very different approaches, which we explained to the patient very careful. Option 1 being first bone reconstruction surgery, 1 in each quadrant, so 2 bone reconstruction surgeries, then wait at least 6 months for the healing. After that, another surgery to place the implants and wait 3 to 4 more months for the healing before we can proceed with final impressions. So this means 2 more surgeries and post-op to bear with, and of course no guarantees of success. For that reason, we consider this a high risk option. Also with a high cost involved, and meaning she was going to spend at least more 10 to 12 months in treatment. Option 2 was staying only with the 5 healthy implants she already had and design a short span fixed dental prosthesis with 10 teeth, this being of course the low risk option. But after any final decision, let's see what the literature tells us about the short span fixed dental prosthesis. So we found multiple systematic reviews and meta-analyses in which the authors concluded that this treatment strategy meets the requirements of a functional dentition and does not impair masticatory ability. Also, it is considered to be beneficial for the high-risk patient as it may avoid the risk of over-treatment while still providing a high standard care. Following the information we gave to the patient, she decided to go ahead with a short-span fixed dental prosthesis. Here, an occlusal view of our OMNI abutments ready for final impressions. Again, in this case, we followed a complete digital workflow, so in order to perform our digital impression, we attached the scan bodies to the OMNIs. Here, another picture of the scan bodies and also a video that shows our final impression. Again, we scanned the provisional restorations of the patient inside and outside the mouth to obtain important references for the final prosthesis. And here you can appreciate our final prosthesis, some more pictures of the final restoration, and this is a metal framework and zirconia. Here the pictures immediately after placement of the final prosthesis. Another picture. These are the periapical X-rays confirming the fit of our prosthesis to the OMNI abutments. Here we have the close-up pictures, a social smile and also a maximum smile. We can appreciate that the reduced number of teeth do not compromise the aesthetic of our smile. And now some before and after pictures, first on a front view, then occlusal view, and the extraoral pictures. Finally, the final panoramic X-ray. The next case we will present is a full mouth case in which the oral rehabilitation consisted in 2 full arch fixed prostheses over implants. This is the initial extraoral picture. We can see that he shows very little teeth when he smiles. Here, the initial intraoral pictures, we can notice the absence of several teeth, generalized tooth wear and bad oral hygiene. Also, aesthetics in general was very compromised in this case. Here you can see the panoramic X-ray of the patient, the intraoral and radiographic examination, so panoramic, periapicals and CBCT revealed partial edentulous arch, the presence of periapical infection and also extensive carious lesion on several teeth. Also significant attachment loss and tooth mobility. The vertical dimension of occlusion was reduced to the loss of posterior support and also excessive wear. So following a proper diagnosis, the treatment plan proposed for this patient was the extraction of all the remaining teeth, placement of 5 implants in the maxilla and 6 implants in the mandible, immediate loading of the implants, and as final restorations, full arch screw retained prostheses over multi-unit abutments on the maxilla and over OMNI abutments on the mandible. On the mandible, the patient exhibit less soft tissue thickness, so that's why we selected the OMNI abutment as prosthetic components. The OMNIs have smaller diameter than the multi-units, 4 mm versus 5 mm of the multi-unit abutments. Also, it's important to mention that prior to implant placement, a decontamination of the deep pockets was carried out. This is the initial intraoral scanner of the patient. We use the scanner together with photographs and CBCT to be able to do a proper planning of the case. The first part of the preoperative prosthetic planning is a 2D facial-driven smile simulation. I send these files to the lab technician so she can translate the 2D smile simulation into a 3D mockup. With a 3D printed mockup and a silicone index, we can try the previous plan design on the patient's mouth. Both us and the patient approved the try-in, so it was scanned and superimposed with a preoperative intraoral scan and CBCT to digital plan the implant surgery.
So, due to the systemic patient's systemic condition, it was decided to perform the surgery separated. So, we performed first the upper surgery, and 3 months after that, the lower one. In the upper arch, after extraction of all maxillary O+ teeth, the implant sites were prepared through a guide according to a specific drilling protocol and using the CTEC guided surgery kit, followed by the implant placement. All implants were torqued with at least 45 newtons of torque to ensure enough primary stability for immediate loading. After the implant placement, we placed multi-unit abutments and torqued in place with 25 newtons of torque, and the full arch provisional screw return restoration was delivered at the same day of the surgery. Here you can see the integral picture of the final of the provisional restoration on the maxilla. So after that we go, and 3 months after that we did the lower arch surgery. So as I said before, we did the guided surgery, and the OMNI abutments were also planned on this specific software using both the CBCT and the STLR files from the intraoral scanner. Then it was done the superimposition of the files, and it was then the implant position in the software. So in this case, to improve the precision of the surgery, we designed two different surgical guides. The guide 1 was designed without any digital extraction, and then the guide 2 was designed after the digital extraction of all the teeth except the canines. So here you can see the first guide. This guide was placed before any extraction and previously planned, and used to place implants on the molar region and right premolar region. Then the first guide was removed, all teeth but the canines were extracted, and the second guide was seated and used to place the implants on the anterior and left premolar region. We also made some bone regularization, and after the implant placement we placed OMNI abutments with 25 newtons of torque and sutured.
So after placement of the OMNI abutments and to be able to deliver a provisional fixed prosthesis on the same day of the surgery, I did a full arch conventional impression over the OMNI abutments of all implants. Also placed 3 temporary titanium abutments over the OMNIs and attached the interim prosthesis to the temporary abutments using tooth color acrylic resin. Finally, a full arch provisional screwed restoration was delivered. This is the panoramic X-ray with both temporary fixed prosthesis. Here you can see the intraoral pictures of the patient with the immediate fixed temporary prosthesis and periapical X-rays confirming the adaptation of the lower prosthesis to the OMNI abutments. Here we can appreciate some extraoral photographs of the patient with the provisional prosthesis. Already a big improvement in terms of aesthetics of his smile is noticeable. And then 3 months after the lower and 6 months after the upper surgery, we proceed with the final impressions. In an occlusal view, after removing the lower fixed provisional prosthesis, we can appreciate a healthy appearance of the soft tissue around the OMNI abutments. And now let me take this moment to explain to you why in this type of restorations we like to work on abutment level instead of implant level. The literature tells us that its use, instead of connecting the superstructure directly to the implant level, results in significant lower marginal bone loss, less soft tissue inflammation, and also higher soft tissue stability. Also, this abutment level setup protects the implant from overload and compensates for some degree of implant's divergency. This will result in less mechanical and biological complications. Here you can see a video of the final impressions on the lower jaw. And finally, we delivered in the upper arch a full arch screw-retained fixed prosthesis over multi-unit abutments, and in the lower arch a full arch screw-retained fixed prosthesis over OMNI system abutments. And this is the final extraoral situation. These are the final intraoral pictures, and here you can see the final panoramic X-ray confirming the proper fit of our final prosthesis. Finally, we can appreciate the comparison between initial and final situation of the patient. And now let's jump to the last case of this lecture. These are the initial external photographs of the patient. The main reason that brought her to us was having several old treatments that were failing, and also the fact that she was not happy with the appearance of her smile. We can see that the smile is not harmonious and that she presents a big upper midline deviation. In these initial intraoral pictures, we can better understand some of the problems she had. So we can see bad marginal adaptation and fractured crowns, several gum recessions, deep bite, and a lot of other problems. And then when looking to the panoramic X-ray, we confirm that she has a congenitally missing lateral incisor. Also, we can notice that the front teeth were already extensively restored. When doing the smile analysis of this case, we can see that the previous doctor tried to transform the right canine into a lateral incisor with a ceramic crown. However, the result was not aesthetically pleasant. Also, we can see that tooth proportions, general shape of the teeth, and also color were not okay. Finally, the position of the gingival margins were not harmonious at all. All of these things combined were creating a dramatic aesthetic problem. In this case, especially because of the missing lateral incisor, a careful planning was of great importance for the final aesthetic outcome, and you'll see later that without it, it would have been impossible to have the results we ended up having. So after a proper clinical and radiographic evaluation, we concluded that the incisors were already very fragile, with history of multiple restorative and endodontic treatment, and with a very questionable prognosis. And that's why we finally decided to extract and replace it with dental implants. Here you can have a more detailed overview of the treatment plan we proposed to the patient. We decided to maintain the implants that she already had on the second quadrant, as they did not show any sign of infection. Only the crowns were replaced. For the anterior bridge, we decided to use the OMNIs as the intermediate prosthetic component due to its smaller width compared with the multi-units. Here our plan was to do an implant-supported restoration without pin component, which means the restoration will directly emerge through the gums, simulating the natural dentition. And for this kind of cases, it's very important to choose prosthetic components that most closely resembles the dimensions of the natural teeth. So in order to start our case, as you have seen also for the other cases, we do an initial intraoral scan. This scan will aid on the 2D planning, 3D planning, mock-up design, guided surgery planning, and also provisional design. Here you can see the 2D smile simulation I did, basically by correcting tooth proportions and dimensions and also the position of the midline. I managed to create space for the right lateral incisor that was missing. I sent this 2D smile simulation to the lab and asked for the 3D mockup. Here you can see the photos of the patient with the mockup. The patient was very happy with the new appearance of her smile, especially regarding the right lateral incisor that she never had before. The mockup was approved and used to plan the implants. As already stated, the planning of implants based on the desired final position of the teeth is a key factor of success in implant dentistry.
So, after we approve the mock-up, this is the same story as we told before. We have to do the prosthetically driven implant surgery, and to do that, we do the guided surgery and plan the implant's position in guided surgery. So, first we start with the original STL, as we saw before. After that, we have to superimpose the mock-up with that original STL, and after that, plan the future position of the implants based on the future position of the restoration. So in the image on the left, you can see already the implants on the position desired. After that, we had to extract virtually the teeth on the original STL in order to be able to design the guide and to print it to our future surgery. So this was the position that we planned for the surgery. On the implant 14 we placed a implant 3.8 by 13 millimeters. Then for the implant on the 11 it was a 3.8 by 13 millimeters too, and 22 the same, and this is the position. And here you can see the guide after we finished digital planning of the implants, and this is the guide printed, and it's
Previous to the surgery, we also obtained the provisionals for the immediate loading and a guide to help with proper positioning of the teeth. Here you can see another picture of the provisionals and the position guides. This is an occlusal view. As you can see, this guide, besides helping with positioning of the provisionals, also gives stability during the process of attaching the provisionals to the temporary abutments.
so same story. The first part, and really important, being very careful with the tissues in order to preserve the soft tissue and also the bone. So you have to be very careful using the blade and doing an intracircular incision, and then the forceps to do the extractions. After the extractions are done, we can place the guide and check its fitting. As I said on the first case, what I do to check is to see on the cusps of the teeth and see if the cusps are placed in the windows and they are set in the final position that is desired. And if everything is okay, we can start the drilling protocol, and then after the placement of the first implant, what I did was to place an anchor stand to increase the stability of the guide. So this is the close-up view of the anchor stand that as I mentioned before, it is helpful to achieve a better stability of the guide. Then we can go and proceed with our surgery and go for the placement of an implant on the 11. We use the bars until the 3.5, and after that the first implant. And as I said in the other cases, what I do is place each implant at a time, especially in cases where I want to do immediate loading. So after that we go for the drilling and the placement of the implant on the 22. This is the occlusal view of the implants on the final position.
And after implant placement, we proceed with the placement of the prosthetic components, in this case the OMNIs. Again, regarding the OMNIs, they basically have the same function of a multi-unit, however they present a small diameter which will favor our pink aesthetics. Then, in order to obtain our immediate provisional restoration, I attached the temporary titanium abutments over the OMNIs and attached the interim prosthesis to the temporary abutment using tooth color acrylic resin. Here you can see the provisionals and the guide. And this is the result immediately after the surgery, already with the immediate provisional screwed in. This prosthesis was designed according to the previously approved mock-up and milled from a PMMA disc.
And in terms of the soft tissue management, here it was done a connective tissue graft to increase the volume and quality of the soft tissues. And on the area of the right lateral incision that was missing, I also made a suspended suture in order to increase the chance of having interproximal papilla. Also, I took this opportunity to cover the gingival recession on the root of the 13. So this is a lateral view close-up immediately after the surgery. And here the post-operative panoramic X-ray. These are the photographs 1 week after the surgery. Everything was healing very well, and I think we could manage to increase the volume of the tissues, cover the root recession on the 13, and have a good aesthetics for the first week of healing.
And here, a comparison between initial situation and 1 week after the surgery. We can note already big improvements. Not only she has now the right lateral incisor that was missing, but also has better tooth proportions and the deep bite had also improved. Also, we can observe that the gingival margins are much more harmonious now. This is a 3-month follow-up. These are the extraoral photographs 4 months after the surgery, and at this point we were ready to proceed with the final impressions. This was the appointment of the final impressions. You can see the scan bodies in place. And here a screenshot of the final impressions. Also a video of the final digital impression. The upper arch with more detail. And finally the scan of the provisionals. As for the previous cases, the lab technician will use this scan to copy important references such as the shape of the teeth and the emergency profile of the restoration. Here you can see also some steps of the laboratory workflow, the final design of the crowns on the CAD software, and the final restorations after being milled and finished. This is the final result. Here you can see the different restorative work. From 17 to 15 we have a bridge over teeth. On the 14 we have a crown over implant. On the 13 and 23 we have single crowns over teeth. From 12 to 22 we have a bridge over implants, being our Pontics the 12 and 21. And from 24 to 26 we have a bridge over implants. This is a lateral view of the other side. And now the occlusal view, where you can see a proper contour of the facial soft tissues around our restoration. Another front view of the final situation. This is a close-up of her smile. And here some before and after pictures. First in occlusal view. Front view with the teeth open. Also we did some restorative work on the lower, in this case direct composite restorations and bleaching. Front view with teeth closed. Here you can see an important improvement on the bite as well. Extraoral photographs before and after front view. You can see that we managed to correct the position of the upper midline, to improve the shape and proportion of the teeth, and to create a space for the right lateral incisor that was missing, obtaining a very harmonious and aesthetically pleasant smile. Here the lateral view, left side and right side, and the final panoramic X-ray. And that's it. Thanks for joining us and hope you have enjoyed this webinar.
Thank you. See you next time.